Clovis offers the physicians a path to implement remote patient monitoring within their practice without any out-of-pocket expenses for them or any additional workload for the nurses or office staff through our all-inclusive rental package. The rental package includes the technical requirements needed to bill CPT code 99454 and the clinical requirements needed to bill CPT code 99457. Clinical requirements consist of a registered nurse spending a minimum of 20 minutes each month reviewing the vitals collected from the patient's home and having a phone conversation with the patient discussing the results. Technical requirements consist of collecting vitals from the patient at home and transmitting the readings in real time to a health cloud. The patient's responsibility is to monitor their vitals through the equipment supplied to them a minimum of 16 times per month. Clovis will assist the patients with this task by supplying a cellular transmission device that eliminates the need to pair with a personal cell phone, and to supply the patient with a watch that will record their vitals continuously. The watch is a consistent reminder to the patient of their responsibility of staying engaged with their health and the importance of tracking their vitals. Clovis has also created a 5-star rating system that functions as a patient report card. The patients who have improved and followed the doctor's testing protocols will be rewarded points that can be used to purchase items through our online gift store or to purchase more equipment to enhance their health. Remote patient monitoring is good for the patient and good for the doctor, offering information that enables the doctor to view health trends and implement changes before they become critical. RPM also offers a respectful increase of revenue for the doctor's practice and should increase the star rating for the practice. The suggested path for the patient to sign up to RPM is during the patient's visit to the doctor's office. There is an additional payment for the introduction of RPM payable when the patient visits the doctor's office. The patient is more likely to understand the value of RPM when told about it at the doctor's office rather than to be contacted by a stranger on the phone. Once the patient signs the form accepting to be monitored from home, the documentation is sent via fax or email to Clovis. Clovis will do the welcome call to the patient immediately after receiving the sign-up sheet, followed by sending the cellular gateway, vital watch, and the FDA-approved piece of equipment needed to track the patient's chronic condition. If the patient has more than one chronic condition, then the second piece of equipment will be sent out within 90 days of the first shipment. After the equipment is received, a follow-up call will be performed by our customer support center to assist the patient in testing their vital for the first time and answering any questions that may have. Our remote registered nurse will track the patient's test results and will contract the patient each month for a couple of minutes or for as long as needed. Clovis' goal is to improve the patient's health by keeping the patient engaged in their health to obtain optimum results. Thank you for your interest into Clovis rental program. The next video is a recorded webinar explaining the web portal and cellular application.